Hi, this is Walt Fritz. When a clinician, when an SLP, when another health professional comes to take my Foundations in Manual Therapy, Voice and Swallowing Disorders class, I think they perceive the class as one that they're going to learn some useful and nifty hands-on manual therapy interventions for voice and swallowing disorders, which they certainly will, and I certainly hope they do, and that's certainly one of the goals of the class. But I think underneath it all, my goal is to bring about a change in how we view the therapeutic interaction, view how manual therapy works, but is also how other interventions work. And when I say work, I mean the thought that somehow when we do manual therapy, we've got the ability and the skill, and we learn that ability to target the specific tissue problem and fix it, in essence, to take care of it, to reduce the problem, that sort of thing, as if we have the magic hands to find it and fix it within the peripheral body of the person. And the new evidence really doesn't support that at all. The new evidence is saying essentially we're using the tissues, if you will, as a signaler to higher centers. Signal to the brain, signal to the perceptions, the beliefs, the fears, the expectations of the patient. And based on that new information, I sort of evolved manual therapy when it comes to this work from it's all about the tissue to it's all about the person. And I strive to elevate the power relationship in the therapeutic interaction to one of equality, or as much as possible equality, through shared decision making and some other concepts. And I really do hope that you leave my class, yes, with some manual therapy skills to add another layer to your interventions. But what I really hope for is that you leave seeing a different perspective on how our patients receive and process and create change in themselves with manual therapy, as well as all other interactions. So if any of this sounds interesting to you, let me know. If it sounds confusing to you, let me know, because a lot of people are still teaching those tissue stories. It's all about the tissue. It's all about the fascia or the trigger points or even the lymph or anything else. And while those tissues are in there, there's a big old human being responsible for all of that. And I think once we learn to work with the person instead of their tissues, our outcomes are just going to be better. And interventions are just going to be more effective. So if you have any questions, let me know.